Bismillahirrahmanirrahim. My name is Dr. Samashwak and today I am going to talk about the pathology of Cushing syndrome. And in this lecture, I am going to discuss about the definition, what are the causes of Cushing syndrome, what is the circadian rhythm, what is the normal physiology of cortisol, what is the clinical picture of a patient who presents with Cushing syndrome and how to diagnose this condition. So we will start with definition. So, Cushing syndrome is a disease which is characterized by hypercortisolism. Hypercortisolism mean high elevated levels of cortisol in the serum or blood. अब हमें पता है कि cortisol कहाँ से रिलीज होता है. This is the adrenal cortex. The outer portion is the adrenal cortex and the inner portion is the adrenal medulla. Adrenal cortex have further three parts: zona glomerulosa, zona fasciculata and zona reticularis. So this zona fasciculata is responsible for the production of cortisol. And there are various mechanisms which are controlling the production of cortisol. For example, hypothalamus releases CRH या CRF, corticotropin releasing hormone, which enter the blood, which enter the vessels, and via these vessels it is carried to the anterior pituitary. It is carried to the anterior pituitary and stimulate the corticotrophs to release ACTH. So hypothalamus releases corticotropin releasing hormone which enter the blood vessels. There is a hypophyseal hypothalamic portal system. This CRH enters the blood vessels and carried to the anterior pituitary, where it acts on the corticotrophs and stimulate them to release ACTH, adrenocorticotropin hormone. This ACTH then acts on the zona fasciculata to release cortisol. So the cortisol is released into the blood circulation. Now, what are the various causes of Cushing syndrome? I already mentioned that definition of Cushing syndrome is hypercortisolism, mean high level of cortisol. So what are the causes which are responsible for hypercortisolism or Cushing syndrome? Their causes are divided into two categories: exogenous causes and endogenous causes. Exogenous cause, the one most important exogenous cause is the use of steroids, especially glucocorticoids, steroid drugs, especially glucocorticoids. These drugs are mostly used in patients with some autoimmune disease, especially rheumatoid arthritis, and a patient with asthma. So use of these steroid drugs, when the person takes these drugs, the steroid drugs, for example glucocorticoids, will activate the cortisol receptors present on the various tissues of the body. So it mimics hypercortisolism. मतलब क्या है कि ऐसे हो रहा है कि cortisol हमारी बॉडी में प्रोड्यूस नहीं हो रहा है एक्सेस, लेकिन हम जो स्टेरॉयड ड्रग्स ले रहे हैं दे मिमिक द एक्शन ऑफ कॉर्टिसोल, एंड अब जब वो अपना एक्शन शो करेंगे तो ऐसे लगेगा कि जिस तरह एक एग्जैगरेटेड एक्शन ऑफ कॉर्टिसोल पर्सन में हो रहा है, जिसकी वजह से पर्सन को सिम्टम्स आएंगे कुशिंग सिंड्रोम के. सो स्टेरॉयड ड्रग्स विल मिमिक द एक्शन ऑफ कॉर्टिसोल ऑन द वेरियस टिश्यूज ऑफ द बॉडी एंड कॉजिंग कुशिंग सिंड्रोम लाइक सिम्टम्स. सो number 1, it causes Cushing syndrome. Number 2, when person is using steroid drugs, the steroid drugs will inhibit the release of this CRH from the hypothalamus, which in turn decrease the production of ACTH. Secondly, it directly by negative feedback inhibition, it inhibits the release of CRH, which in turn decrease the release of ACTH, and it directly inhibits the release of ACTH. So due to both of these mechanisms, there is a decreased production of ACTH. When there is a decreased production of ACTH, there will be loss of the stimulating action of ACTH on the zona fasciculata. So what happened, that it leads to atrophy of the adrenal gland. So an important point, that it causes the atrophy of adrenal gland due to decreased production of ACTH. Now what are the endogenous causes of Cushing syndrome? Number 1, pituitary adenoma. Functional pituitary adenoma, which is deriving from the corticotroph. For example, hyperplasia of the corticotrophs. When there is a hyperplasia of this corticotroph, there will be an increased production of ACTH. When there is production of more and more ACTH, it will act on the both adrenal glands and stimulate the zona fasciculata to release more cortisol. Okay, so when there is a production of increased ACTH, it will causes a stimulatory action on the zona fasciculata of the both pituitary gland, and there will be production of more cortisol. So hypercortisolism will be developed. Secondly, ectopic ACTH production, mean that ACTH is produced from a non-pituitary gland tissue. Okay, for example, it can be seen in patient with carcinoid syndrome. More importantly, small cell carcinoma of the lung, and in the medullary carcinoma of the thyroid gland. In these syndrome, there is a ectopic production of ACTH. When there is a more ACTH, it will act on the zona fasciculata and stimulate the production of cortisol. So there will be more production of cortisol, and hence it will leads to Cushing syndrome. And the fourth one is the adrenal neoplasm. Adrenal neoplasm, for example, neoplastic growth which is deriving from the adrenal gland. For example, adenoma, more commonly adenoma of the adrenal gland, or sometimes carcinoid tumor or carcinoma of the adrenal gland. When there is adenoma of the adrenal gland, there is production of more and more ACTH. As there is a hyperplasia and hypertrophy of the cells, they are producing more cortisol, and when there is a more cortisol, it will definitely leads to Cushing syndrome. Cushing syndrome caused by pituitary adenoma due to overproduction of ACTH, mainly due to these corticotrophs hyperplasia, and sometimes it may also arise from the tumor. For this CRH is also produced from some type of cells. If there is a hyperplasia of these cells, they produce more CRH, and their more CRH will stimulate more corticotrophs to release more ACTH. So mainly overproduction of ACTH is due to these corticotrophs tumor, but sometimes it may also arise from tumor of the cell that are producing this CRH. So Cushing syndrome due to pituitary adenoma, मतलब कि पिट्यूटरी ओरिजिन है जिसका, इट इज आल्सो नोन एज कुशिंग डिजीज. So these are the various causes of Cushing syndrome. Exogenous causes, which are the use of steroid drugs, which leads to atrophy of the adrenal gland and Cushing syndrome. And endogenous, which are pituitary adenoma due to overproduction of ACTH, ectopic ACTH production in carcinoid tumor in small cell lung cancer and medullary carcinoma of the thyroid gland, and adrenal neoplasia, for example adenoma of the adrenal gland. यहाँ पे हम थोड़ा बहुत मॉर्फोलॉजी के बारे में भी बात कर लेते हैं. इफ़ अ पर्सन इज टेकिंग स्टीरॉयड ड्रग्स, यहाँ पे तो मैंने मॉर्फोलॉजी पहले से मेंशन कर दी है कि there will be a negative feedback inhibition of ACTH, which leads to loss of stimulatory function of ACTH over the zona fasciculata. As a result, it leads to atrophy leads to atrophy of the adrenal gland. So use of these steroid drugs leads to adrenal atrophy. If a person is if this disease is due to pituitary adenoma and there is production of large amount of ACTH, this ACTH will act on the both kidneys, and when it acts on both kidneys it causes bilateral diffused hyperplasia of the kidneys. So it will be like this will be diffuse hyperplasia of the adrenal gland. Same in this case of ectopic ACTH, and if it is due to adrenal neoplasia, there will be also hyperplasia, but a type of nodular hyperplasia. Okay, so this is the morphological picture, a small review on the morphology, and these are the causes. What is the circadian rhythm associated with Cushing syndrome? I mentioned circadian rhythm according to the cortisol. Now we will discuss about the circadian rhythm of cortisol and the normal physiology of cortisol. So when we have to do a lot of work, for example during daytime, we require a large amount of energy, and at that time during morning when we have to do work and require energy, the level of cortisol is very high, and with the passage of time the level of cortisol in the blood decreases, and at night it reaches to its minimum level. So at morning time the level of cortisol is maximum.